Okay. Yes. So once again, thank you all for joining our July Information Exchange. Today we'll be talking about patient transport, and we have speakers from Homerton University Hospitals, and from ERS team that will be giving some information about patient transport, and where possible, we'll be responding to your questions. Very quickly for this, why we decided the topic to be patient transport is because there is already piece of work going on within HealthWatch Hackney. My colleague Fabian and our wonderful team of public representatives are working on, as I said, piece of work around patient experience with public transport. And the complete report hopefully will be published soon. But Fabian and his team have been looking at every possible aspect of patient transport that is linked to patient experience. And this will include accessing services, being picked up from home, the journey to the hospital, communication with the patient transport, the return journey home. And within this, they looked at the comfort and safety, cleanliness and equipment, vehicle suitability, staff interaction and response, impact of delays, logistical challenges, impact on medical appointments, as well as physical and emotional impact of travel. And of course, we looked at the carer's perspective as well. It's only an hour meeting, and we will hopefully receive the report once it's published, because this will also have recommendations for improvement. But today's meeting is to give a bit more general information about patient transport. And our speakers today, I'm sure, will be providing this very useful information. So without taking so much time, I would like to pass it on to Kyle. If you can introduce yourself as well, that will be much appreciated. Thank you.
Yeah, brilliant. Hi, everyone. It's an absolute pleasure to meet you all, and thank you very much for joining us today. My name's Kyle. I'm the Deputy Director of Facilities here at Homerton. I've only been in post for about 7 weeks, so I'm not going to tell you that I'm an absolute complete expert around the patient transport services that we provide yet. So if there are lots of questions and stuff like that, we as a team will be able to answer them for you, though. I'd also like to introduce Jackie, who is our lead for the contract. We've also got Deanna on the call, and shortly we ought to have Graham as well, who's just finishing up a wonderful infection control meeting where he was presenting some of our data. So he'll be along shortly as well. And then from the contract side, we've got Gary and we've got Lee as well, representing ERS services. So what I thought we'd start off with doing is if I share my presentation with you, and it will give you a little bit of an idea around the services that we provide here at Homerton in partnership with ERS. So can everyone see that? Just a shout out of a yes would be great.
Yes.
Amazing. Okay. So what is patient transport? So patient transport services are provided to patients who are unable to attend their hospital appointments by public or private transport due to their medical condition. And who's eligible for patient transport? So eligibility for NHS funding transport is based on criteria set by the Department of Health and Social Care. Eligible patients are those whose medical condition is such that they require the skills or support of patient transport service staff on, after the journey, and or where it would be detrimental to their condition or recovery if they were to travel by other means. Also those whose medical condition impacts upon their mobility to such an extent that they would be unable to access healthcare, and or it would be detrimental to their condition or recovery to travel by other means. So the eligibility criteria. So how will my eligibility be assessed? And it's done through a series of questions are asked to assess the eligibility. The same questions will be asked if you book your own transport or if transport is arranged on your behalf. The team will then advise if you have been found eligible for transport and arrange a booking. If you are found ineligible for transport, we will also notify you so you can make alternative arrangements. Each time you request transport, one of the team will check if this service is still right for you. And this is important because your medical condition and transport needs may change over time. Localized trusts with their localized specialities will be able to define what the criteria is, and Homerton's criteria was agreed with the clinical leads within the organization. We also have a slide here, which is kind of just showing the mobility codes as well, just to show you that we do categorize our patients to ensure that we are able to provide them with the best available transport and means. So how far can you go? So for inpatient discharges, transportation will be provided to the hospital or care home where the patient will be placed. For example, it could be a care home in the north of England. Transport for follow-up appointments is not provided by our trust after the patient has been discharged from Homerton. For outpatient appointments, transport will only collect a patient from home and then take them to a Homerton related appointment. So how is it organized? So bookings are made through the ERS call center, and a series of questions are then asked to assess the eligibility. The same questions are then asked if you book your own transport or if transport is arranged on your behalf. The first initial appointment is booked by the GP services, and there is information on how to book transport in the vehicles and at the liaison desk in the main reception of the hospital. Currently, a new patient transport leaflet is being developed as well to assist. How to complain if something goes wrong. Sadly, sometimes things do go wrong, and there are leaflets on the vehicles with the process on how you can complain and raise any concerns to us. To make a complaint through ERS, you can call the call center, and this will be logged as a formal complaint, and a letter will be sent with the acknowledged number to the address given. There's also a drop-in service at the main reception of the hospital where patients can log an informal complaint or concern, or they can call the numbers below. There's our PALS team, and they can email our PALS team or our complaint service as well to make a complaint. So our plans for development. It is a reactive service that meets the needs of the organization. The fleet currently consists of 19 vehicles, 4 of which are electric, and our goal is to have 90% of the fleet of vehicles green by 2029. This is another stage in our journey to net zero. It not only reflects our commitment to net zero, there's also a pledge to the residents of Hackney to improve the air quality in the area. So that's our presentation around the services, how to access and what we do. So I'll hand back to you, Karanaya.
Yes, thank you, Carl. That was pretty quick, and again, quite a lot of information. Thank you very much. Just so everyone knows that this presentation will be shared with everyone at the end of the week, just in case, together with the recordings of the meeting. Any questions for Carl so far? No. I had a question, Kyle. You just mentioned about, I think it was on where you can go with the public transport for the outpatient. Did the presentation say that the transport can pick up the patient from home to their appointment only?
I believe we would pick up a patient from home to location if that's what was requested. Absolutely.
Okay.
I would
what about
actually
the return journey?
Return journey would be back to home as well. That would be to the origin point.
Okay, because I think I didn't see that in the presentation. Just wanted to clarify that.
Yeah, no problem. And Jackie, do jump in if I'm getting it completely wrong, but I think that was correct.
It said in your presentation, for outpatient appointments, transport will only collect the patient from home and take them to a Homerton related appointment, but it doesn't mention the return journey.
No, but sorry, go on, Jackie, you jump in.
Sorry, that will be when the journey's booked, it automatically books a return journey, so the patient is returned to home, but the patient's only taken to a Homerton referral appointment via ERS.
If it's the outpatient thing.
Yes.
Okay. All right. Thank you for clarifying that. Fabian.
Question was around booking the transport. At the beginning of the presentation, as I recall, you said that it would be arranged by the GP. Is that right? But then later on, I saw one of the bullet points being that you had to call a certain number to book the travel. So there was some slight confusion for me there on whether or not the GP does that or whether the individual does that, because some people have reported on occasion the transport not turning up to pick them up on more than one occasion, actually. And I wonder if that might be part of the issue. I don't know. So which one is it then?
So guys, either ERS or Jackie or Graham, do you want to jump in on that one? Jackie's got a hand up.
So for the first initial appointment, the GP books the transport for the patient, or they would assist the patient doing that, booking the first appointment. After that, the patient can phone up themselves via the call center, and then they'll give them a reference number themselves. If it's in terms of the discharging, it will be our clinical teams, or in some departments book transport for the patient as well. So there's different processes, but the first initial appointment, because the patient's being referred to the Homerton, it's done via the GP.
Right. Okay, thank you.
Thank you. Any further questions? No. I'll have another question. Thinking about how diverse, how many different communities are in Hackney, and with some people, language barrier is an issue. How would you? Sorry. Sorry. Thank you. How would you support patients whose English is not their first language and perhaps need to arrange their transport but don't know the language? I can't say that in English. If they needed to arrange the transport themselves.
Yep. Has anyone got anything to add on that one? Okay, so this might be something that we. Sorry, someone jump in there.
Sorry, apologies. I'm having some technical issues with my computer. Apologies. So in terms of patients who if English is not their first language, sometimes the patient may refer to PALS in terms of getting some help to support making the booking. But that we have had some questions asked about this, but this is something that we can take back, because there are some there are some leaflets in the vehicle that have sort of indications, pictures to help with people when they're traveling, but there's no different languages when they're phoning through to make the booking, essentially. So that's something we can take back to look at.
Yeah, that seems like a really positive thing for us to do. In previous trusts where I've worked, we've had interpreter services that we can access for support. I'm only 7 weeks in, so I'm not 100% sure whether we have that here at the minute, but that's definitely something we're going to find out.
That's fine. This is why these meetings are called information exchange. So we can, yes. And my other question would be about carers. So are carers allowed to come in with the patient when transport is booked in? Because we often speak to people and we often go to Homerton Hospital or St. Anne's Hospital where people actually come in with the patient transport. And sometimes we hear that carers are not allowed to come into the vehicle with patients.
I can answer that one. Absolutely. Sometimes it's essential, especially if the patient's got dementia or language difficulties or sort of just can't take in information. It's really vital that an escort travels with them so that they can be looked after whilst on their appointment and travelling. Definitely.
Okay, so if this happens, for example, patients can actually raise a formal complaint through the channels that you suggested, right?
I think what we would like to hear from patients if they are having concerns with this. I think from what I understand about the service so far, we are a little bit restricted sometimes where it comes to picking up multiple patients and bringing them into the trust. Therefore, patients always take always the primary passengers that we aim for. So sometimes we like to group them together just for efficiencies. But I think we also need to take into account that sometimes that's not always going to be appropriate and that some patients are going to need some more support. So I think that's something that we need to take back and have a think about. And I would urge people on the call to let us know about this, because the more information that we get, the more data we have and the more evidence we can to make changes. I think Deanna's got a hand up as well.
Yes. Hi, Deanna. We can't hear you. No, we can't hear you yet.
Do you want to work on trying to get the mic going, and then
Yes.
we'll move on, and then you can jump back in when you're ready.
Okay. Shirley. Hi, Shirley. Over to you, Shirley.
Very quietly.
I cannot hear anything.
Oh,
Oh, hi.
Hold on.
Yes. Hi, Shirley.
hello.
Hiya.
Yeah, so about people accompanying patients, that really ought to be a standard question when a booking is made. Do you need to have somebody with you? And then the whole thing is really clear from the beginning, you know, because sometimes, as you say, if a transport is doing a bit of a round robin, that's something they need to know and can clarify, and they might have to rearrange perhaps that particular patient if it's absolutely essential, and you know that you're going to be very unlikely to be able to take in extra people. So that ought to be really one of the early questions early on, so that you know that's clear from the beginning all round, both for the patient and you.
Brilliant. Thanks, Shirley. One of the things that we have had is we've had a preliminary report from Camden Health Watch's visit, where there are a number of kind of action points and suggestions for change. And there are some items already in there. So what we're planning to do is to put together a bit of an action plan, so that we can work together as a whole group to address some of the concerns. It absolutely does make sense what you're saying, that we need to understand more and more about the patients before we can make decisions about how best to support them into the trust and back home again. So thank you for that.
Thank you. Diana, do you want to try again? No, we still can't hear you. Would you like to leave the meeting and join again? See if that will work. Are there any further?
Can you hear me?
Yes.
You can,
Yep.
yes, perfect. Yes.
Okay, so I just wanted to add on the carer. So whenever a patient would book a transport on the call center, they will go through the eligibility criteria every time they would book. So part of the questions is for carer eligibility as well. So not necessarily everyone will be eligible for a carer to come with them. It could be a patient that would need support from their home going to the hospital, well, walking assistance, but they wouldn't be necessarily be eligible for having their carer with them, if that makes sense. So
No,
this is why
again, Diana?
This is why every bookings patients needs to go through the eligibility criteria, because it could change anytime. So it would be determined if the patient is eligible for a carer to travel with them once they do the booking.
I see.
I think what we've got a process where we are trying to gather as much information as possible from the patients to understand what their needs are. But I think from listening to what Shirley said, we might need to just rethink: are we actually asking enough? Are we building up enough of a picture? And I think that's something that we can review to try and improve.
Thank you. And there is something else that I would like to share from experience by talking to patients again regarding patient transport. That would, you know, we speak to many people, and I would say that most of them would really share very positive feedback about the crew that will come to pick them up or will take them home, but they will have serious complaints about the time they're picked up from home, and especially the time they will be picked up back to get home. Mm-hmm. They're clueless about when they will be picked up back home. And then they start worry about missing their medication because they have to have them with after lunch, for example. You know, in Hackney Hospital, Costa Coffee is not the most affordable place for people to buy lunches from. So all this really impacts on their well-being and mental health, if you like. And I'm really glad to see this in Fabian's report, because it's about how emotionally this affects people. And we've spoken to people who have been waiting for 3 hours, for example, and they still didn't know when they will be picked up.
Yeah.
We had other, I mean, in one other instance, I spoke to a lady who was waiting for the transport to pick her up in St. Leonard's Hospital, and she saw the ambulance crew taking another lady who she came with to the hospital at the same time, but they took her first, although this lady that I was talking to, she finished her appointment much earlier. And yet nothing was communicated with this patient. And I think this is one of the biggest issues there. I mean, lack of communication or unclear communication that people are given. Does that make sense?
Yeah, yeah, absolutely does. Yeah. Does anyone want to jump in on that, or would you like me to?
No, I think it's fair comment, isn't it? If you bring it to our attention, we can look at that. I'm sure there's lots of things that may happen within the waiting area. Sometimes people may go first because the other people in the vehicle could be going the same direction because it's more than one person going home. But I think fair comment, and again, as part of the action plan, it's all this feedback that gives us a chance to review that, and then so we can get back to you with some more positive communication when you're on site.
Yeah, I've got a little bit to add to it, but I'd love to get Shirley in first.
Hi, Shirley. Would you mind speaking a bit louder, if possible, Shirley? Thank
Okay,
you.
yeah, is that better?
Perfect.
Yeah.
Yes.
Yeah, I was just going to say, you said that you were, in response to what I was saying, you would write something up. I'm just wondering whether, when, like for instance, in the document that you've prepared that we've already seen and are talking about and making suggestions about, was there any service user input into that initially? And if not, should you not be considering maybe having a service user person in your group from the beginning, so that you've got service user input, their perspective from the start, and then that way you can sort of preempt issues and questions and situations maybe?
Yeah, I think that's a really valid point. We can't really speak to the past, so we're not 100% sure how the contract was established and the tendering process, and whether or not service users were brought into that discussion. But as a team, we've kind of had a little discussion already around some of the feedback we've received, and one of the things that we are really passionate about is actually reinstating kind of user group, so that we can get this direct feedback from users, because it's absolutely amazing what the HealthWatch team have done, because they've opened a window to the patient for us, which is brilliant. But we need to be doing that regularly ourselves. So that's definitely something that we're passionate about doing. Where it comes to getting user information, the service needs to be built around patient need. So I think that's something that we're looking to learn from. Thanks, Shirley.
Well, we're very happy as well as HealthWatch to support you guys on this, especially around collecting patient feedback and sharing this with you, also suggesting recommendations. So we're definitely happy to work with you on this, and I guess that will be for another meeting to discuss. Fabian, over to you.
I was going to add some personal insight into the issue of communication with patients. So I spent the day at the Homerton in the waiting area with various people assisting me in speaking to the patients, and what came out of that was in part that the optics were a little bad, because on that day in the afternoon, for example, I counted almost 10 empty ambulances just parked outside, and lots of drivers all dressed in green. I think they were, and just hanging around, being pals, talking, whatever. And the patients are sitting there not knowing when they're leaving. One of the people there said to me, "Go and look outside. There's about 10 ambulances waiting outside." But yet there didn't seem to be a protocol where the staff came towards patients to tell them, because some of them had been waiting 2+ hours. I watched them because I was there the whole day. No one came to the patient saying, you know what, you've been here a while. Is everything okay? The reason you haven't been chosen is this. Now, I presumed, as you said, that, you know, they'd want to fill an ambulance with all going in the same direction. It would make sense because I was told that there was a controller somewhere that he needed to, you know, there was a whole process that needed to happen. So I went out and asked one of the drivers and said, so I guess you have to wait till you're going in the right direction. And he said, not at all. If only. He said, we get given patients, one could be going in that direction, one could be going in that direction. So let me give you an example. There was a blind man sitting there, and he'd been sitting there for a long time, and he looked a bit distressed. So one of our representatives, one of our volunteers, went and spoke to him, and it turned out he was really thirsty and needed a glass of water. We didn't know who to ask because he was sitting there blind. And so when we informed the staff, of course, the staff were wonderful. And this is what comes through in the preliminary, you know, findings of the report. The staff are great. Everyone loves them. They get to know their patients quite well because they tend to be picking them up again. But there didn't seem to be a protocol in place for, if somebody's waiting there for 2 hours, it would take 60 seconds to go and speak to a patient and say, this is what's going on. You haven't been picked up for this reason. We are expecting this. I'm sorry it's taken you that long. It's taken that long, you know, and people then are reassured. Meanwhile, if you don't reassure them, they're distressed. And there's a expensive coffee shop behind them, but a lot of them say they're scared to go in because what if I go in and I don't hear my name being called? Yeah. You know, so there is some anxiety there from people. And I've spoken to people who have waited all day and not been taken home. I spoke to somebody who waited from 11 a.m. to 7 p.m. and had to deal with their child who had come home from school. Luckily, they had a key. So what I want to raise is that a little bit of communication will go a long way, a very long way.
Yeah, I think the points that you're raising there as well, we read those in the report, and they were things that didn't sit very easy with any of us. I think you're right in saying that it is all about the communication, about how we can improve upon that. We can't talk to what happened on that particular day. We can't talk to why all of the ambulances were there, but it's about ensuring that the process is efficient and that effective communication is happening. I think does anyone want to jump in on that, on any potential quick wins that we can do, or any ideas for improvements at all?
I can just mention something on that. Just recently, in the last 3 weeks, we've put a new control room in place, which is something that we felt that needed. And it's actually a previous controller communication, things are starting to look up already, which is really positive from our side. It had to happen. So definitely. So I sort of can't answer questions on that day, as you said, Kyle, but definitely that is an improvement that's going and being put in place.
I think one other thing that's really important is we all know that the NHS is very, very busy, that it's very, very overstretched, but we're very passionate about the fact that patients are not a number to us. So Fabian, the things that you brought up there, they just seem like such easy wins. We could communicate effectively with our patients and provide them with some reassurance. I can absolutely I've never experienced it, but I could understand the point of view with that blind gentleman as well, how he's not completely aware of everything that's going on around him as well. The additional support that's needed, and I think we need to go back and think about how we're going to provide that, and then bring that back to the group and ask for your feedback on whether we're getting it right.
Yeah, I think communication will be also useful for these carers who are family members, and they are actually assisting their parents or their family member to the hospital, and perhaps they have to go back to work after that. You know, communication is obviously very important. Shirley.
Yes, I am wondering, I mean, there may be
Shirley, can you speak a bit louder if you can?
Okay, yes. There may be an explanation, but what I'm wondering is how, whether there is an explanation for somebody who's blind being on their own in that situation in the first place. Does somebody in that situation know that there's somebody they can call on, or why, when the arrangement is being made, maybe there's a question to be asked there, are you okay for getting there in that way on your own? I mean, that does seem a bit hard for a blind person to be sitting in a in a waiting area and have no way of knowing what's going on.
I would say that having kind of worked in NHS services before, one of the really important things is not to take away people's independence. If they feel that they are capable of making the journeys and stuff without escorts, without support, absolutely we should do what we can to support them with that. But I think you raise a really good point that we're just hearing about this retrospectively. We don't know, and that could have been something that we could have asked, that we could have provided that support with as well. Clearly they did need assistance though. If they were very thirsty, they needed a glass of water at the very least. So that you raise a good point, Shirley. We ought to have better communicated in that situation, and I think that goes on our action plan to make sure that we can cover these instances off in the future.
Thank you. And I think what I would like to get confirmation in this meeting, if possible, Atefe, I'll come back to you if that's okay, just very quickly before I forget, is about what if the transport takes the patient too late for their appointment at the hospital. Because so far from talking to people who were late for their appointment, they've been always saying that although they're late because the transport is booked through the hospital, the professional who they're supposed to be seeing them will always make the time to see them. So their appointment won't be cancelled as it will be for someone else who is late for their appointment. Is that the case every time?
I might need to defer to some of my colleagues on that one for their experiences.
Maybe Jacqueline.
Hi, can you hear me now?
Yes.
Sorry.
Yeah.
Thank you. Just so every situation's different. So if there are delays with transport, the liaison team should be phoning through to the clinic and departments to where the patient will be going. So depending on the clinician, they will say that they will still see the patient. Sometimes the clinics are cancelled, and then that should be also informed through to the patients as well. So that should be, so on some occasions we've had patients coming in and the appointments have been cancelled. So that should have been relayed through to the patients. And I don't think this is always happening. So sometimes there might be, for example, transport's been booked, but the transport appointment hasn't been cancelled, or vice versa. So that's something that we need to take back and look into as well.
Yes,
on the trust side.
Yeah, I've witnessed a conversation related to this, but I'll share it if there is time. Atefe, over to you. Thank you, Jacqueline.
Thank you.
Good evening, everybody. Thank you for this time meeting. I just wanted to know about the limited area when you call, for example, for an ambulance for a NHS transport. Once I have been living in Newham, and now I am in Hackney. Once I was calling to ask for a NHS transport, they told me that we don't cover that area. I wanted to go, for example, in a clinic. I don't remember the name now, but they said that we don't cover that area. I just want to know, what does it mean? What should I do, or what is the rule if you want, for example, to ask for an ambulance? Because if I am a patient and I'm not responsible for the appointment that they are given to me, they send me maybe everywhere for MRI, for pain clinic, for anything. So it's not me that identified the district, the destination. So why they say, for example, we don't cover that destination or that area?
So were you actually coming into Homerton Hospital? Or were you going to Newham Hospital?
No, not actually just Homerton, maybe other clinics. Is it just about NHS transport for Homerton or other clinics?
Yes, it is. So our service is just for Homerton Hospital. So we would bring you in from your home address to Homerton Hospital. But what we wouldn't do is bring you in from your home address into any other hospital.
So does that mean that the transport for, let's say, Whipps Cross Hospital should be arranged by Whipps Cross and not Homerton Hospital?
Absolutely.
So the referral to that hospital is made by a professional in Homerton Hospital?
Yes. So if you were going from a home address to Whipps Cross, you would need to phone up Whipps Cross Transport. We would only provide a service for Homerton Hospital and any of the sister clinics.
And is that information provided to the patient who is requesting that? Would for example, Atefa, I hope that will make sense to you. So let's say Atefa she needed to go to Whipps Cross Hospital and she called Homerton Transport Services and said, sorry, we can't cover that area. Will then the transport services provide Atefa with details for Whipps Cross Transport Services?
Yes, we would say that we wouldn't cover that area, and being Whipps Cross, we would know that it would be Whipps Cross service. So we would then tell them, our call centre would say that they would need to contact Whipps Cross Transport Service.
No, that's clear, but will the call centre provide the contact details for this hospital transport services?
I think that's something that we need to go back and talk together as a team, because an example would be the other day I had a call, my phone was just going, my landline number, and it was the first call I've ever had, and I picked it up, and it was someone who started talking to me quite quickly about their condition, and I was like, well, hold on, you've got through to the facilities department here. So that was clearly someone not signposting someone correctly, and we helped them get back to the switchboard, absolutely. But I think by providing patients with that information about how they can go forward. Not all of our patients are internet users, they're not. So while some of us might just Google Whipps Cross number and we'll be on the phone to them in seconds, that can't happen for all of our patients. So I think this is something that we can go back, think about how we can provide that information.
Thank you. Atefa, did that respond to your question?
Understood. Thank you.
Thank you.
Thank you.
Maggie, you've raised your hand.
Hello. Can you tell me about being, patients who are being sent home from hospital who have been an inpatient, how that works?
Yeah. Is anyone able to? Jackie's got her hand up. Are you on mute, Jackie?
Sorry, apologies. Good afternoon. Just to let you know, when a patient's being discharged, this will go through an assessment with the clinical team, and then your transport will be booked regarding your clinical needs. And then what happens, the OT and some of the ward staff will go sit together, and they'll go through a list of questions, and this will determine people's eligibility for what transport they need, and that would include the mobility type. So they'll go through some questions, for example, the patient's weight, do they need to be carried into the property? So there's a list of questions that the therapist and the ward staff will go through before transport's being booked, and that will be put on by one of the ward staff. And then once the patient's gone through the discharge checklist, they'll be book ready for collection, and then ERS knows the controller will allocate the journey to one of the crews, and then the patient will be collected once the patient's been book ready.
And how long do you sort of judge that this takes?
In terms of being collected?
Yes.
So we've got a process that we've got so for example, if your transport was booked yesterday and you was booked on the system today, that will be classed as a pre-planned booking. So the estimate time is 1 hour pickup. If it's an on-the-day booking from today, that will be a 4-hour wait. That's our KPI for on-the-day bookings. So whatever time you're book ready, that's when the time starts ticking, sorry, for when the patient will be collected. If there are any, sorry, go ahead.
No, sorry, carry on.
No, so if there's any issues that may affect the discharge, the team ERS should be liaising with the clinical staff and the facilities team, and then the patient should be updated. So
and that happens, does it?
It should be happening on the ward, yes.
Maggie, have you got any times when that hasn't happened that you feel?
Well, I was being discharged and it didn't happen for me.
Right.
It was going to be such a long way. I ended up phoning somebody to come and get me.
Mm-hmm.
Otherwise, I would have had to stay another night, which that's not really the.
Oh, we apologise for that. We would like to hear some more from you actually on that, so that we could potentially improve the service going forward. Yes. If you'd be happy to share your account with us.
Certainly.
Thank you very much.
Shall I arrange maybe, maybe Carl, which email address should I send to Maggie so she can email?
Yeah, please do.
Details?
Yeah, if that's all right, Maggie, or if there's a number provided, we can give you a call.
Fabian has all the information.
Perfect. Thank you.
All right. Thank you. And Shirley.
Yes, it kind of connects with that last point, actually, what I was going to say, which is that when somebody tells a patient, okay, we're going to recommend you for discharge, or we are saying that you can be discharged, it would be good if somebody could routinely say, now what happens next is, because, you said we're going to do this and we'll meet and we'll decide that. The patient, it's no reason why the patient can't be told that. Put them in the picture, say, this is what happens next. You can expect to hear from us about that within such and such a time. Just to include the patient in the available information. Why not? That's
an amazing idea, Shirley, and we can work with our clinical teams.
And I think it's all about communication again, isn't it?
Yeah.
Just little things. And we've got another 15 minutes. I don't know if anyone has any questions, but I'm really curious to hear from Gary. Gary, are you one of the drivers that takes patients?
Oh, I have been a driver, but at this now I am the regional manager, so I cover both.
Okay. All right, so at least you can speak from experience, because I really want to know what are the challenges that the drivers perhaps have, and something that you think could be improved that you can. I'm sure you do a great job. I mean, that's what patients are telling us, really. But is there something that you think could be done to make things easier for you and for patients as well? Or what are the challenges that you and your colleagues have when dealing with patients?
I think and obviously I'm going to use Lee to support me on this because she knows Hackney much better. When I've gone out, obviously I'm not from the area. So again, mine is the local knowledge. We're very lucky within the drivers that we've got. So we've got 30 drivers working on this contract. We've got experience up to 25 years within this contract, down to new drivers that have only been with us 6 months. So that's the newest. And we've got an intake that's just going through training at the moment. So ours is about the knowledge. The drivers in the area, it's about knowing sort of which road to go down, which road not to go down. Lee's got more vast knowledge of the roads because the plant pots, what they're called, which cause delays for our vehicles. What size vehicles can go down what size roads? Because if you can think, the size of our ambulance is a sort of a large van. The ramp then comes out with them blocking roads, which then causes residents to get the ump because obviously we're blocking the roads. Multiple, I think, and also the London traffic is the biggest frustration. And if you don't know the way around and how to avoid that, then that obviously causes the frustration to the patient, which is why we have knowledgeable drivers and the ones that aren't as knowledgeable going out with knowledgeable drivers to understand the area to try and support, because that'll obviously reduce the delays.
Thank you, Gary.
I think, can I just add something to that as well?
Speaking? Oh, Lee, okay, sorry.
I think another major challenge that we come across is the mobilities of patients. Obviously, patients have, been in their flats for many years and got older and less able to get upstairs and things like that. So the mobilities have increased quite a lot throughout patient transport, which does have an impact on the service.
And is the crew allowed actually to support patient to come into the ambulance, like to lift the patient?
Yes, so we have all our crews are trained with manual handling and obviously transporting. Transporting patients in and out, up and down stairs. We've also got 2 stair climbers on the contract. So if some patients may need 4 people to carry them up and down stairs. So that's a big challenge. And
that's all this information you collect when the patient calls you in to book their transport?
Correct, yes.
Thank you. Fabian?
I had a conversation with one of the drivers on the day that I was at Hamilton University Hospital, and in the driver's defence, what he explained to me was we know that there is a 2-hour window that people are given to be ready by, and he said that the first people he would pick up tended not to be ready, which would then delay each successive pickup. And so he would, he explained that, a lot of times the ones you pick up right at the end of the 2-hour window, they think you're late, but the ones that you pick up, at 7:10, can't believe how early you are and they're not ready. So I asked him how he dealt with that. And he said that his response to that was once he picked the first person up, he would then send a text message where he had the person's number and give an approximate ETA for the next person. And I said, oh, great, that must really help. He said, no, they're often still not ready. But I wonder if that could be something that, if they're not already told to do that, drivers can give ETAs each time, because they can look at the traffic. I mean, you can't be perfectly accurate, but if you've got a sat nav, it will generally tell you. I mean, is that something worth looking into, just to make sure that then people have a time to get ready by, rather than thinking they might have 2 hours and and them not being ready, especially when there's issues around dementia.
Yeah,
absolutely, definitely. A really good idea with them phoning, and we encourage them to do so once they've left the first patient's address, is to phone through just with an ETA. But something that we're also looking for improvement on is some of the clinics are quite early for transport patients. So with us being able to pick up somebody 2 hours prior to their appointment means that sometimes somebody just going into a clinic could be picked up at 7 o'clock in the morning, which is not ideal. Carers may not have turned up. So that's something that we're working very much with the clinics to try and move appointment times to improve the service.
Can I ask, some of the feedback I've received, not just through this consultation, but at other times, have been from elderly people. One of our reps is a carer for somebody, and we interviewed her for this report. And she's a carer for her neighbour who's in her 90s and has dementia. Having her be ready at 7 a.m. for a 9 a.m. appointment is, we know that even the mayor's office wrote to the hospitals to say, stop expecting over 60s to be in appointments at 9 in the morning when they and they can't even use their free bus pass, their free travel pass isn't before 9 o'clock, so they can't go by themselves anyway. you know, is that something that's within your remit? You know, the older patients, or is that purely to do with I don't know, is that the hospital's remit? Or?
I think on that one, I mean, it would be really interesting, Fabian, if you could send through some of the detail on that to us about where the mayor's office did write out, because then we can liaise with our clinical colleagues about that.
It was reported. It was reported in the London newspaper.
Oh, okay. All right. Well, we can do a search for it if we don't have the actual background.
No, I can share it with you.
That would be amazing. That would be really good, because that's how we all make changes. You know, it's live and learn, isn't it? So, and one of the things that like I said previously, we did have a kind of group discussion about the report before we joined today, and it is a lot of the issues that were raised are about communication lacking. And that's another example where if we could get to a situation where patients were aware of when the driver was going to attend, it would improve things. No, it's not always going to improve it. It you know, there will be individual cases. That's absolutely, but that shouldn't stop a process being put in place. The issue we've got at the minute is we haven't got the answer just yet. So we need to go away and think through in our action plan about how we might be able to do this. So I think that's something that we can come back to the group on.
Thank you, Kyle. Leah, very last question from you.
Yes, please. Thank you, Canaria. Just my question is, disabled patient missed the appointment because of the delay of picking up, and then he missed his appointment and he was really disappointed. He just contacted us yesterday. And then I just want to know, because he's imagined to get another appointment, it's going to be hard for him. And he was really, upset, and then he just missed his appointment. So can you do something about this, or just to have any idea, please, to feedback the patient? Thanks.
So do we have a process here of what happens if a patient misses an appointment? Because this is a learning curve for me too.
Is that, sorry, I didn't get all of.
I didn't hear it all.
So the patient.
I didn't.
Okay, Leah, correct me if I didn't get it right. Yes, so apparently the patient had transport booked in. They came to pick him up, but they were late for the appointment for the patient. And the professional apparently was unable to see the patient, which meant that they needed to book another appointment. And we know that often there is a long waiting time for appointments. Will this patient be prioritized then if it wasn't his fault, but it was because the transport was late? Is that correct, Leah?
That's right, yeah.
Perfect.
You have to wait. They didn't give it to him. You have to wait another appointment, because it's not his fault, because the transport arrived late, and then he couldn't make it. So you have to wait another day, another appointment, in order to receive treatment. Thanks.
I wouldn't be able to speak on behalf of the clinical teams, but that's something that we can take back. But what should be happening if transport is late or doesn't pick up the patient, they should be relaying that with the clinical staff, and that should be relayed back to the patient. But I wouldn't be able to speak on behalf of the clinical teams because how they send out appointments, but that's something we can take back.
Yeah,
I think that will be.
Apologies for that.
Thank you. Yes, and in case anyone has any questions that we couldn't think of today, I'm pretty sure there will be some. I hope you, Lee, Kylie, and Jacqueline, and Graham, and Gary wouldn't mind if we get in touch with you to raise those questions later on. And
always. It's the only way we improve our service. So we are always keen to hear from service users.
Just something very quickly I wanted to share. A couple of weeks, or last week, I was in Hackney Hospital collecting patient feedback, and because I speak Turkish and I could overhear a conversation a Turkish-speaking lady had on the counter where colleagues from ERS were, and she clearly wasn't able to speak English. But luckily, one of the drivers there was a Turkish-speaking, and he was able to help because apparently her ambulance didn't turn up and she had to find her own way. Apparently, her appointment was cancelled, but she wasn't notified, and so on. But I was wondering, what would have happened if this guy wasn't there to interpret for this lady on the day? And so I was really happy to see that the communication went on. Yes,
No,
communication.
I think that's something that concerns us as well. What would have happened if the driver didn't speak Turkish, if they didn't have that support there? And I think where we answered previously around advocates and support in that kind of way, that's something that we need to look into to see if the trust does have that service, because I'm just not sure it does yet. But we can feed back to the group. But thanks for that. That's really valuable story. Thanks.
Yes. Excellent. Well, any very good questions? No, I cannot see anyone's hand raising. Well, I would like them to say thank you very much for joining, for the great presentation and for responding to many questions. If any outstanding questions, just let us know. But until then, thank you very much all for joining, and we'll see you in the next information exchange.
Brilliant. Thanks so much.
Okay, thanks.
Thank
Bye-bye.
you.
Thank you.
Bye.
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 Thank you.
Thank you. Bye.